I'm Julie Deering. I work for the Oklahoma State Department of Health. I'm the state programs coordinator, and I work collaboratively with Michelle Camacho on our CDC school health grants. I also have a lot of capacity in worksite wellness, if that's something that interests you, but I do a little bit of everything at the health department in terms of chronic disease prevention and health promotion.
And I am Michelle Camacho. I'm with the State Department of Education. I am the director for a CDC grant, Project Get Fit, which focuses on nutrition, physical activity, out of school time activities, and chronic disease management within schools. We have statewide initiatives for professional development, but we also have 5 target districts, 4 of them, which are in Okmulgee County, Henrietta, Okmulgee, Wilson, and Morris, and then 1 school in Hughes County, Calvin Schools. So I work with them on any of the initiatives that I just stated that our grant focuses on, as well as creating action plans with the schools to increase their school health index scorecards and get them to a better, healthier place. So anyway, yeah, so I team up with Julie with the Department of Health. We have a great, fabulous team working on this project. And anyway, we're excited to share out the WSCC model with you guys and possibly, look at ways that we can have better community partnerships for our schools. So that's kind of why we're here today.
Great. All right, I'm going to go ahead and get started. Just a quick show of hands. How many here have actually heard about the whole school, whole community, whole child framework? All right, it's going to be new. Excellent. Well, on our agenda today, I'm going to provide an overview of what the whole school, whole community, whole child framework is, or from this point on, I'll be calling it the WSCC model. So if you hear me say WSCC, that's what I'm referring to. And then we're going to discuss WSCC in action. I was able to get some Okmulgee County specific examples of ways WSCC has kind of been integrated, and we could just talk about how organizations can also support implementation of the WSCC model or the whole school, whole community, whole child framework. So learning objectives for today, by the end of this presentation, you should at least be able to describe what the WSCC model is and identify ways community organizations can support WSCC in schools. So just a quick history. So while the WSCC model came about 2014, it's a relatively new model. It was actually developed through some more evidence-based frameworks. First, the CDC Coordinated School Health Framework, which has been around since the late 80s. And then ASCD's Whole Child Initiative. They kind of took these 2 initiatives and put them together to create the WSCC model. So as you could see from the graphic, the WSCC model places the child at the center, and it takes a comprehensive approach to supporting learning and health. Additionally, it calls for greater collaboration across sectors. So I'm going to take this framework because I know there's a lot that kind of is going on in this model, and we're going to break it down for you. So starting with the 5 whole child tenets. In order for a child to perform at their best capacity academically, they must feel in the school environment, they must feel safe, engaged, supported, challenged, and healthy. So then, in order to achieve these environments where the child feels safe, engaged, supported, challenged, and healthy, um, there are 10 components that must be uh, in place in the school environment to achieve this. So these 10 components include health education, physical education and physical activity, nutrition, environment and services, health services, counseling, psychological and social services, social and emotional climate, the physical environment, employee wellness, family engagement, and community involvement, which we're going to go deeper into some of these components later on in the presentation. So in order to coordinate these components, one must look at policy, process, and practice so that they're not being implemented in silos. This model is meant to break down silos. So through the coordination of policy, process, and practice, we work to integrate and improve those environments through facilitating awareness of issues, leveraging resources, and reducing program duplication and fill gaps. And then lastly, this gold band represents the community. So schools are a part of a community, and support from community organizations such as you guys is essential for implementing and integrating these 10 components to create these healthy environments for students to thrive in the center. So examples of community organizations that schools partner with could be local health departments, hospitals, social service agencies, parks and recreation, and law enforcement and churches. And then this quote came from, there was a whole Journal for School Health article that was published on the evidence behind the WSCC model. And it says, but this is not a model that calls for health for education's sake, nor is it education for health's sake. Rather, it is a call for health and education for each child's sake. So now we're going to discuss the model a little bit and what it can look like in action. So first, this model is adaptable to any community to meet the needs of the school district. So we recommend school districts start off with the School Health Index, which is an evaluation tool to kind of assess implementation of each one of those 10 components within that blue band there, to see where they're doing well, where their strengths are, and where they might need to build up capacity or partner with organizations to integrate those components a little more fully. Nutrition and environmental services. Of course, CDC has a framework for this. So nutrition and environmental services in the school site kind of looks like this. So there's Smart Snack guidelines for schools, for students to purchase foods either a la carte, through in-school fundraisers, vending machines, and school stores and snack bars. But also there are guidelines for healthy school meal, access to drinking water, and then classroom celebrations, events, and non-food rewards. So through regulating food and beverage marketing and having healthy eating learning opportunities, as well as staff role modeling, students can have an environment which reinforces healthy food and nutrition messages that they're learning in their health education classes. So what can you do as an organization to help reinforce healthy nutrition environments? You guys can adopt standards for healthy nutrition. If you offer food or snacks, having those snacks meet a healthy requirement. The great thing about smart snacks is there's a lot of lists out there that tell you which snacks fit those food requirements. So you don't have to think about it. You don't have to get out this nutrition calculator to figure out, oh, is this a healthy snack or not? The Alliance for a Healthier Generation has developed these great, even down to the brand and size of which snacks could be helpful. Also, adopting healthy nutrition standards help improve children's diet and quality of and food security. So things like offering breakfast. I'm not quite sure the types of services you guys all, although I learned a little more about what Stephanie does, which is exciting. But it helps to create consistent and accurate messaging around good nutrition and allows ways to learn and practice healthy eating. So Stephanie, you said your organization kind of does like healthy life skills, like counseling and training for families. You could do like healthy meals, how to shop on a budget for healthy diets, meal planning, things of that nature can help reinforce those healthy nutrition habits for students. But also, if you guys do pantries where people can come and take food, encouraging people to donate healthier foods for those pantries is a great way. There's the backpack program that schools partner with organizations to be able to give healthy foods and snacks for kids who are at risk for food security so that they have food on the weekends. So these backpacks are often passed out on Friday, and that way the students have healthy meals on Saturday and Sunday as well as snacks. So when they come to school on Monday, they've ensured that they've had been fed. Since we're a smaller group, we can just open up the mic. Are there some nutrition programs that you guys already offer that you could think about that could help support healthy nutrition in schools?
I don't think with the folks who are on this call, anyone is focusing on the nutrition initiatives within those programs.
Okay, I'll move on. Thanks, Nancy. Physical education and physical activity. So we know this is a child's brain on the left after just 20 minutes of walking. Compared to no exercise at all. We know that physical movement, physical activity does ignite and light up that brain for healthier learning. And so our goal is to make sure that kids are getting that recommended 1 hour of physical activity each day. And of course, we know every minute of physical activity counts. And so, not only is physical education the cornerstone for teaching lifelong physical activity skills in the schools, there are other opportunities throughout a child's day to get physical activity. So for example, physical activity during the school day, could be like recess opportunities as well as brain boost activities in the classroom, like maybe right before a test or something like that. Physical activity before and after school can look like walking school buses or intramural sports, or maybe there's a walking or running club before or after school that a kid can participate in. We know that staff involvement helps increase physical activity, particularly if they're doing it with the kids on the recess. Maybe they're coordinating a more structured game, as well as the family and community engagement. So maybe you guys there's a 5K being offered, or as a part of those healthy skills that you're working with families with, encouraging them to go on a walk every day when the weather's nicer. All encourages that movement and family time for them to add together to get that 60 minutes of physical activity and help with their brain activation for learning. So I went through some of these examples, but community sponsored events, activities, clubs. One of the neat things in Oklahoma that we've done is every spring, there's the Oklahoma City Marathon. Well, they have a children's marathon that they put on as a part of that. And a lot of schools, so what happens with the children's marathon is kids have to run/walk the first 25 miles, and they've got 2 months to do it. So a lot of schools, they'll put like a big printout of the marathon course. And as kids complete their miles, they can move themselves along the course to kind of track their pattern. And then the day of the actual marathon, they run that last 1.2 miles together. And it's a really neat thing, but that's something a youth organization can do too, if you want to encourage movement there. Active commuting to school. I've got some pictures from Okmulgee County that I got from Michelle in my next slide, but as well as intramural sports. So this was done October 2nd, 2019 in Okmulgee. Michelle, which schools are these? I got these from your presentation I had before.
This actually is Begg schools. When I was at Begg, they do a big walk at school day because I think like 99% of the kids bus in. So anyway, they walk at school day and really promote walking that way.
Okay. Yeah, so there's some like neat events that you can kind of tack on to, like National Walk to School or Walk at School if the school site is on like a state highway where it's not safe to walk to. But you know, all of it encourages walking and healthy habits. And then of course, you know, I know Scott Robinson, he does the jump rope clubs before school and has had great success with those. I got these pictures here from him. But I mean, the stuff that he does with the students in the schools is just amazing. I watched him present a couple months ago and he showed some videos, and I mean, who knew you could do that stuff, those tricks with a jump rope? So you have some great things already happening in your county to promote physical activity here. Sometimes it's just awareness of the programs to be able to promote or market to families as well. Shared use is a thing that community organizations could do. to partner with schools. So I don't know if your organization might have like a nice kitchen or something like that, where you could do cooking lessons with the community, or it could go the other way where you partner with the school to be able to use their kitchen to offer cooking lessons to families. But also having that partnership with the school to be able to use the track or athletic fields after hours. The state actually in 2010 timeframe, they passed a law that indemnifies schools, where it basically took the liability off schools, whereas if they enter into a shared use agreement with an organization or the community, that if something happens, if someone gets injured, they're not liable for that injury. That a lot of times is a huge concern for schools to not enter in, but thankfully they are actually protected by our state law. But also some congregations settings, they'll offer like Tai Chi classes to adults that goes for falls prevention. Or you can offer classes to the teachers. We don't want to forget our teachers. They need physical activity, good nutrition, healthy clubs too. So if you can offer something for the teachers to help with their employee wellness, that in turn also helps with academics to their students. Health services. So health services in schools can range from chronic disease management to acute emergency care to care coordination and family engagement. And I know this is something Scott was the last training that I attended with him and Nancy. They were going to look at potentially offering telemed services in the schools. So through the Mvskoke Creek Nation medical services, looking at ways where they could partner with schools, where if a student presents with some symptoms, or maybe they have asthma or diabetes, where they could get on a telemed medicine program and talk to a physician or a nurse right there to receive some diagnostic services to determine whether they need to go back to class or what the next course is. So it helps them to not skip or miss a lot of school, because if they could get those appointments done at school, they don't have to leave school to drive to a service to receive it. So coordinating health services can help support healthcare needs of children with chronic illness, such as asthma and diabetes. It also helps with communication with school health services and staff to have a plan in place, especially if they're working with a community organization to receive those services, as well as have a plan in place for potential emergencies. And then last, of course, I want to say, please don't forget about the teachers, particularly now. If you have stress management offerings, I feel like that is a huge one that teachers need now, particularly with COVID. Self-care is not selfish. It's taking care of yourself to be able to rejuvenate so that you could be your best self for the people that you provide services to. But I say the WSC model has a child in the center, but that child could just as easily be a teacher in the center to receive those mental health services or counseling, social emotional learning practices, healthy nutrition, physical activity. It's all things that adults need to be our best selves as well as kids. So just don't forget about them. So I'm new to presenting on Zoom, so I'm trying something different here. But I thought if you guys go to the top, oh my gosh, you should have an option that says annotate, where you can actually type text. And I wanted to do just a quick brainstorm. The text comes through as anonymous, but type in ways that you might think that your organization can help support schools or families to integrate these components into a child's lives. So if you select text and then type something on the whiteboard, so I'm going to type something like, I'll just type whisk. Then you click out of it and it shows up on the whiteboard. Ah, you guys are figuring it out. Weekly workout sessions, nice. Send resources, yes. What kind of resources do you guys have? I'm just curious. Partner with schools to use their facilities. Yes, you know. Oh, they're just greeting my daughter. Community games, yes. So I was gonna say schools have great facilities, right? They have these great like athletic facilities and kitchens and stuff. So being able to partner with them is huge. Ooh, online workouts, yeah. Especially in COVID, we've had to learn to be in this virtual world, haven't we? Anything else? All right. Thank you. It's the first time I've done that exercise on Zoom. That's exciting. Text lines that send out tips and information. Yes. So yeah, messaging, motivational messaging really helps to support people in their healthy behavior. So I love this text line to send out tips. We do nutrition tips, just healthy, switch out this for that, or, you know, community school walking clubs. Excellent. Yeah, walking is the most basic form of physical activity. Most people can do it and they can really build up their stamina just through walking in the morning. Well, thank you for participating on this exercise. Oh, wait. How do I, okay. Oh, I've got to clear it. Okay. Clear all drawings. Yes, excellent. So another thing, so all schools are mandated if they participate in the school lunch program with the USDA, they are required to have a school wellness policy. And so shared use could be a part of that school wellness policy. But the school wellness policy, not only does it have to cover nutrition guidelines, including marketing as well as how they want to address in-school celebrations and fundraising. But they also need to address physical activity and how they want to integrate it into the school day, as well as employee or staff wellness. So if you are interested in partnering with schools, you can actually help them to fully implement their school wellness policy. Because, you know, a lot of schools, they want to do this stuff for their staff, but they might not have that internal capacity. And that's where having services like you guys in the community to help them to fully implement all this stuff could come into place. And also, I'd love to take the opportunity to invite you to get involved. We have Oklahoma WSCC Coalition. That's a statewide coalition, and we do have a variety of community organizations that are also a part of it. If you can't make the meetings, at least getting on the distribution list. So you could be sent out opportunities for trainings that are coming up as well. Michelle is one of our chairs for the coalition. So she is a good point of contact for you if you'd like to join in. But we do meet every other month. So we try not to meet for the sake of meeting. But we're always trying to find new partners and how we can connect as a state as well to utilize our own resources that we have together. There is a QR code here for evaluation. So if you could just take a minute to fill out our evaluation. Otherwise, I'd like to open up the mic. Does anyone have any questions? And mine and Michelle's contact are also on here. She is local to you guys. She's located in Okmulgee County. So she's great local support, but I'm also here to support you in any way as well.
I have a question about the assessment that the schools use. Is that something that we could look at? I'd be interested in like just evaluating our program as how we kind of do in those different areas.
Yes. So if you just go into Google and type in CDC School Health Index, it will take you straight to the website. I could also send you the link, but you can set up a link as a non-school. So you have to register, and you could register as a district, or you could register as a non-school. So like a community organization such as yourself. And there's 11 modules. So one module for each component of the WSCC model. And the 11th is evaluating their school wellness policy. So yeah, that's a great way to look for ways to support schools. And so what happens is schools, they can go in and they can complete modules. And for each one, they'll give you kind of the strengths and weaknesses within each of those components. And you could do an action plan on how to address that right in the School Health Index platform. And I will say that that platform is anonymous. So the CDC can't even go in and look at your assessment results. That's something I hear from schools like, is anyone going to see this? You know, they're a little bit like nervous, like, oh no, we don't have a school nurse. And I'm like, no, don't worry. This is only for you. The only people who could see the results are the ones that you share your own code with when you register. So it's a great planning and assessment tool for schools to go back and revisit and and get evidence-based strategies on how to implement each of those components.
Awesome. Thank you.
Sure.
Anyone else? Any other questions for Julie? I wrote down lots of ideas of things that we could do within our organization. So I was just looking back at my notes.
Great.
Yeah. I guess maybe just another question would be, um, what else or how can organizations go ahead and like start partnering, just reaching out to the schools, maybe schools they already interact with, or if there's maybe an idea or project, just reaching out to the schools directly at this point?
Yes, definitely. Oh, Michelle?
And if it's, yeah, and if it's one of the schools that I currently work with that I, identified at the beginning of this, feel free to let me know if there's a capacity that you want to start like working with them or have some ideas, because I can help connect you with some of the teams that we have in place as we've worked on this project, kind of help you, get your foot in the door. With the right connections from the get-go. So if it is a school like one that we have identified, then I'd be more than happy to help connect.
Great.
I have a question.
Sure.
So, in order for like the schools, so you said like some of the Omogi schools or Mogi County schools, to be involved, did they have to go through like their school specifically to get the programs in the school, or was it like somebody outside that applied for them, or like how does that work?
For the grant project,
Yeah.
or okay. That was identified based on statistics for Okmulgee County by the Department of Ed when they applied for the grant. So they got letters of they got letters from the schools prior to applying for the grant that they would, agree to work with us on this grant if awarded. But they were identified prior to us submitting the grant, just based on our statistics. And then after we received the grant, we just put the program in place from there. If that, does that answer your question?
Yeah, sorry, I forgot I had my mute on again. But yeah, that answered my question.
Okay.
Any other questions?
And I'll also plug in any of you guys that are looking to partner with schools. I mean, the schools are pretty much receptive if you have an idea or a program that you want to, work with them on. So, like I said, I'd be more than happy to help connect. But if the community partnership's a big part of the WSC model, and it's a big part of our schools. So anytime that we can partner with any programs, especially tribal programs, Oklahoma is so fortunate to have such great tribal programs that anytime that we can partner and provide any of these programs in our school, it's only helping our children and helping us develop this whole child approach to educating our children. Thing you guys come up with, don't ever think that, it's not worth exploring, because we explore a lot of times to see what we can implement in the schools and help to provide more opportunity for our students. And sometimes, they don't pan out, but sometimes things just grow and become great programs. So we're always looking to explore new ideas and new opportunities for our kids.
Yeah, I add that a lot of schools don't know what community organizations have to offer. So yeah, you guys reaching out to them, they'll see it as an opportunity. Now with COVID right now, they might be slow to respond. So, don't let that get you down. But I mean, I've sat with these schools for school health index training and action planning. And when we get to the community involvement, they get a little bit of, oh, I'm not sure what's in the community. I think this is out there. So like marketing yourselves and what you can offer to the schools will really help them put those puzzle pieces together.
All right, great. I think lots of good information. I'm sad we didn't have more folks to listen in with us today, but we'll definitely share this recording with them so that they can get more information and then hopefully also connect with you all in the future and maybe have ideas that will come out for them to partner with their local schools as well. So thank you, Michelle.
Yes.
Thank you, Julie, for being our presenters today. We really appreciate you all, you all having time for us today. So just again, thank you for that.